the topic I'm going to present on is not actually a topic that I'm an expert in, oddly enough, but it is a pet theory of my own, and it's all around improving the way that we do things. There's already been some great points around feasibility, around patient recruitment, around engagement of investigators, and educating patients. All of these different things in isolation, but I'm not seeing it turn into true improvements in delivery on patient recruitment. And so what I'm trying to do is throw out a theory about something that a different way of looking at our industry of clinical trials, which may or may not, it's like a null hypothesis, may or may not change the way that we set up a team of investigators to recruit trials. And I'm hoping that an organisation, maybe like Novartis, that's got a lot of data, or particularly the CROs, will take this, or even some of the big data companies or whoever will take this and say, right, I'm going to do some investigation into this, because it could come up with a new way of doing it. It may be completely wrong. It's just one of my theories, and I'm hoping that it will stimulate discussion. It will stimulate new ways of looking at things that might come up with a solution, or might, everyone can point the finger at me and say, see, Rob, you got it wrong. So we'll see. I think we've got an interesting mix of people. I'm sure there's people here who would have that experience, or at least be able to tap into the data, tap into other companies. I mean, you need an awful lot of clinical trial data to be able to analyse this. But you've got technology, you've got communications, you've got big pharma that has this data. Yeah, I think so. I mean, but it's all about, again, stimulating the discussion. They may know somebody else to go, hold on, let's look into this a little bit more.